Hello everyone. Today we are going to talk about whether pregnancy triggers diabetes and whether could it happen to you. Insulin is a hormone that regulates glucose levels in the blood. This hormone is produced by the pancreas. When the pancreas cannot produce enough insulin or the body cannot effectively use produced insulin, then blood sugar levels increase. This condition where your blood glucose levels are too high is called diabetes. When these high blood sugar levels are seen in pregnant women, it is called gestational diabetes. But what causes gestational diabetes? During pregnancy, your body goes through lots of changes. These changes are made to adjust the increasing demands for the nourishment of your baby. These changes are physical as well as hormonal. Hormone insulin must be produced to control the blood sugar levels. Some women cannot produce enough insulin to meet extra needs in pregnancy, leading to increased blood sugar levels. Who can be affected by diabetes during pregnancy? The answer is any woman can develop gestational diabetes. Even if a woman is not affected by diabetes during her whole life, she can develop it during pregnancy. But there are some cases where extra care needs to be taken. Women over 40, body mass index above 30, previously had a baby with 4.5 kg or more at birth. If you had gestational diabetes in previous pregnancy, one of your parents or siblings has diabetes, if you have had a gastric bypass or other weight loss surgeries, in all these scenarios, you should be more careful. How do you know if you have gestational diabetes? This usually does not show any symptoms. Mostly it is diagnosed during blood sugar level testing. But if the blood sugar levels get too high, then thirst increases. A person has to pee more often. The mouth gets dry. The person feels tired. Blurred vision and genital itching or thrush. Some of these symptoms can be present without diabetes. But if you are concerned, please speak to your doctor. What are the effects of gestational diabetes on baby and mother? If the pregnant woman is diabetic, then the baby is supplied with extra glucose, which is a type of energy. Baby uses this energy to grow, but the baby needs to grow rapidly as extra glucose is being supplied. Growth happens systematically. So extra glucose gets stored in the form of fat and the baby becomes bigger than in normal pregnancies. Big baby is difficult to deliver normally, hence the chances of cesarean section increases. The baby in the womb is surrounded by the fluid to protect and nourish. This fluid increases in gestational diabetes. This condition is called polyhydramnios. This may lead to premature birth, that is delivery of a baby before 37 weeks. High blood pressure is another problem, which is called preeclampsia. This occurs at or after 20 weeks of pregnancy. This can lead to many complications in the pregnancy. Evidence from previous studies shows that the chances of getting preeclampsia increases in the mother with gestational diabetes. The baby may develop neonatal jaundice. In this condition, baby's eyes and skin becomes yellow. Diabetes in pregnancy can cause problems for you and your baby during pregnancy and also after birth. However, the risk can be reduced if the condition is detected early and well managed. Your first antenatal appointment is very important for this reason. Your doctor will decide whether you will need a screening test depending on the risk factors. This screening test is called oral glucose tolerance test, which is OGTT. This test is done between 24 to 28 weeks of pregnancy. During routine checkups, your urine is tested for glucose. If the glucose is present in the urine, then OGTT is recommended. So, is it possible to reverse it? If you are diagnosed with gestational diabetes, you will be under the care of specialist healthcare team. You will also be more closely monitored during your pregnancy and birth to check for any potential problems. The most important treatment for gestational diabetes is a healthy eating plan and exercising regularly. Walking for 30 minutes after a meal can help with controlling your blood glucose levels. Gestational diabetes usually improves with these changes. After you have been diagnosed with gestational diabetes, you will be shown how to check your blood glucose levels and told what your ideal level should be. If it does not reach this level with healthy eating and exercise, or if an ultrasound scan shows that your baby is larger than expected, you may need to take tablets or give yourself insulin injections. Will you be diabetic for your whole life after this? So gestational diabetes normally goes away after birth. There are chances to develop diabetes in future pregnancies, or some become diabetic for their whole life. You should have a blood test to check for diabetes 6 to 13 weeks after giving birth and once every year after that if the result is normal. Some research has suggested that babies of mothers who had gestational diabetes may be more likely to develop diabetes or become obese later in the life. What happens in my future pregnancy? Having a healthy weight, eating a balanced diet, and taking regular physical exercise before you become pregnant can reduce your risk of developing gestational diabetes again. As soon as you find out you are pregnant, contact your healthcare team for advice about your antenatal care, as there is a chance you may develop diabetes again during pregnancy. Thank you for watching this video.